This is a WDIO News Special Report.
If you require operator assistance, you may press star then 0. I would now like to hand the conference over to your host, Andrea Animas. You may begin.
Thank you. Good afternoon, everyone. Thank you for joining us for the COVID-19 media call for August 24th. We will start today's call with a situation report and some updates from Health Commissioner Dan Malcolm. We also have Chris Erzman, Director of Infectious Disease, who will provide a few updates on today's call. After those updates, we will open for questions from reporters on the line. So with that, I will turn it over to Commissioner Malcolm.
Thanks, Andrea. Good afternoon, everyone. The global total as of early this morning was over 23.4 million cases and 809,000 deaths. The United States, as of this morning, has more than 5.7 million laboratory reported cases and 176,000 deaths. Here in Minnesota, we are now at a total of 70,298 laboratory confirmed cases of COVID-19, which is up 717 from the prior day. So Sunday's results were 717 additional cases on just under 12,300 tests from Sunday. This follows a pretty stable weekend of 735 new cases reported on Friday and 725 new cases reported on Saturday. Each of those 2 days had about 16,700 tests. So we've seen some stability in these numbers the last few days. Sadly, we also have had 1,771 total deaths in Minnesota, 4 additional deaths reported yesterday. One of these persons was in Hennepin County, one in Ramsey, one in Scott, and one in Waseca. This includes 2 persons in their 90s, 1 person in their 80s, and 1 person in their 30s with a known prior health condition. There are 310 patients currently in the hospital, 135 of those in intensive care. There was a sort of an up and down pattern in hospitalization over the weekend. We do collect information on how many people are currently in the hospital and ICU each day. But starting this last weekend, we learned of just a few hospitals that are not going to continue reporting that information on the weekends. So we used what they reported on Friday and carried that same total through the weekend for just a few hospitals. We added a note about this on our website. So I mentioned that we've had a fairly stable testing volume in recent days. It's a 7-day growth in testing volume. So week to week testing volume has grown by 7.8% yesterday versus a week ago yesterday, versus 6.8% growth in total new cases over that same time period. The 7-day rolling average test positivity rate is now 4.9%, ticked up a 0.1% from a week prior. And recall that testing positivity data is after a 1-week lag period. So it was 4.9% as of the data on August 15th. I'd like to take a couple minutes today to talk about the challenging situation facing our schools, a situation that some of you may have heard about already today that has impacted the Minneota and Ivanhoe school districts, who had planned to start their school year today. And just yesterday, after learning of a laboratory confirmed case and working closely to identify close exposures, these districts made the difficult decision out of an abundance of caution to delay the start of the school year. I mention this as an example and a reminder of just how fast things can change with this virus. And school districts could be facing this sort of a scenario where they're planning for one learning model and all of a sudden they need to turn on a dime literally before the next morning. So as we approach the familiar day after Labor Day start date for most schools, it's just good to remind us all and to encourage school staff, families, students, and all of us to remember a couple of things. For school staff and families and students specifically, it's so important to practice social distancing, to wear a mask, to comply with all the health guidance, but also, as we've been saying, to lay low before you go, which means take some precautions in those couple of weeks before heading back to school to really avoid gatherings outside of your household and to really be mindful of what you're doing in those couple of weeks before returning to school and to really just be extra cautious during that time to help what you can do to help avoid the kind of situation that we saw in these two districts yesterday and today. And specifically for schools, this is a good reminder that it's important that you have readily available the most updated contact information for all of the families in your schools in case you need to contact them quickly, as these two districts did very well last night. And for schools to make sure that no matter which learning model they plan to start the year with, that they have their plans in place for all three scenarios, in-person, hybrid, or distance learning. As the governor and Commissioner Ricker have said multiple times, it's pretty easy to imagine that many districts will be using multiple models throughout the year. And we know the school year is not going to be easy, certainly not for teachers, for administrators, for kids, for families. This is just a very challenging and fluid environment, and we know how hard our school personnel are working to try to be prepared for these multiple models and to do everything they can to make the best learning environment possible under the circumstances. And because they're working so hard, it's just also so important that all of us in the community be mindful of the effect of our actions and how much it's going to take all of us as Minnesotans working together to keep on exercising all these health precautions in order to do what we can to keep our students, our staff, their families as safe as they can be. Switching subjects to another familiar rite of this time of year, the state fair. Inspectors from our environmental health division at the health department have been out to the state fair recently to do the same kind of regular inspections that they typically do as the fair is holding their drive-through event right now. I really want to give a shout out to the fair. All the inspections went really well for food safety and compliance with the governor's executive orders. Every stand our inspectors went to had a COVID preparedness plan. Every employee was wearing a mask, and every stand was screening their employees. I want to thank the state fair vendors for doing this work and for operating in compliance with the requirements. And I really want to thank our staff for getting out and doing these important inspections as well. This success story is a good example to demonstrate that compliance with the executive orders can be done and vendors can still run their businesses. And we encourage and remind everybody that's attending this event and any other events that you're participating in how important it is to keep following these safety guidelines, keeping social distance, wearing a mask, washing your hands frequently. And with that, I'm going to turn it over to Chris Erisman for some additional updates.
Thank you, Commissioner. Just a couple of things. I wanted to make a reminder for people who live in multi-unit residential buildings, for example, apartments or condominiums, to please wear a mask in the common areas of your building. This means when you go out to get your mail or take out the garbage or are walking in hallways. It helps protect your neighbors when you're outside of your private unit, and these common areas are actually included in the face covering executive order. So remember to put on your mask before you walk out the door. And then I also wanted to provide a quick update on the number of cases that we are seeing associated with Sturgis, simply because I know that that's of interest to many of the reporters. We are currently at 27 cases who have identified attending events at Sturgis. 2 were either an employee or a volunteer. 25 were attendees. This represents 24 households. And I mentioned last week that there was one patient who was hospitalized. That patient was released after 3 days. So that is the update on that situation. And I'll turn it back over to Andrea.
Thank you. As we get ready to open it up for questions, we ask that reporters limit themselves to one primary and one follow-up, and that we limit the number of questions from each outlet so we can get to as many questions as possible. So with that, operator, we are ready to take questions.
Ladies and gentlemen, as a reminder, to ask a question, you will need to press the star then the 1 key on your touchtone telephone. To withdraw your question, please press the pound key. Please stand by while we compile the Q&A roster. Again, the star 1 to ask a question. And our first question coming from the line of Catherine Richards from Minnesota Public Radio. Your line is open.
I'm wondering if you could provide us a little more detail on Sturgis. Specifically, you mentioned these 24 households. These are all in Minnesota, and have anyone in those households, are any of those 27 cases associated with someone who didn't go to Sturgis but maybe lived with someone who did go to Sturgis, if that makes sense?
Yes, at this point, the 27 cases actually attended Sturgis. I think we're a little early for secondary cases. So, yeah, we're at 27 cases and with individuals who indicated that they had been to Sturgis.
Okay, and these are all Minnesota-based cases, correct? People who live in Minnesota.
Yes.
Got it.
Yes, we only report on Minnesota.
Yeah, I figured. Okay, thank you.
And our next question coming from the line of Emily Havoc with Carry 11. Your line is open.
Hi, Jan and Chris. Thanks for taking my question. I'm wondering if you have any reaction to the report today that there's been a confirmed case of coronavirus reinfection coming out of Hong Kong, and what that might mean for immunity and how much immunity we might have after contracting the virus.
Yeah, we are aware of that case report. Chris, would you take that one, please?
Sure. Yep. As the commissioner said, we are aware of this, and it's something that we have been, I guess, waiting for, or at least paying attention to see if evidence of reinfection does happen. In the case of this individual, they were able to do some testing of the virus and identified that, what was identified in the first, with the first illness was different by a number of, it was different from the second time. So in other words, there was laboratory evidence to suggest that this individual indeed had 2 separate infections with COVID. And that's something that we're going to have to be continuing to watch, because obviously it would have been ideal if there was evidence that infection with COVID produced lifelong immunity. And so we're going to have to keep looking for more data on this. And so it's all the more reason why it's so important that everyone needs to continue to socially distance, to wear a mask, stay home if you're sick, all of those messages. And even if you have had COVID in the past, you still need to be attentive to these things, because obviously there's this one bit of data, and we expect that there'll be more data on this in the weeks to come, and we'll be monitoring this. But it is a little bit of a disappointment that there's this evidence of reinfection, although, as I said, not something that we were watching for.
Can you speak a little bit, Chris, to what that might mean for a vaccine? Well, certainly, the goal for vaccination is to make sure that we can provide protection for individuals without having them have to go through natural infection. And so we'll have to, this is one case, and so we're going to have to continue to see what the data look like over time. And certainly, we know that we can have effective vaccination, even in a situation where someone could be reinfected, like with influenza, but it just may change the landscape for what that looks like.
Thanks, Chris.
And our next question coming from the line of Glenn Howard from Star Tribune. Your line is open.
Good afternoon. I'm told that the CDC is visiting MDH today on this vaccine planning effort. Can you confirm that, and what kind of things are you guys talking about?
Yeah, I'm going to ask Chris to describe the visit a little bit. That is correct. We are one of, I think, 5 total states that are part of a kind of a pilot effort with the CDC to help think about and inform planning for the vaccine distribution system. And I think it's a testament to Chris's team that part of the reason we understand that we were selected was because of the strength of our underlying vaccine distribution planning and distribution system and our efforts in Minnesota, although we always know we can do better. So Chris, you want to say any more?
Sure. So I have been a part of those calls all day, and I did, just leave for this media call. And our conversations have really revolved around, kind of CDC talking about some of the things that they're thinking about in terms of vaccination, and then we have the opportunity to reply back from the state perspective. We have partners from local public health who are participating on the call, and from tribal health, and so it's an opportunity when they, for instance, make a comment, then we're able to say, well, in Minnesota, this is what the implications might be. We started by talking about some of the lessons that we learned from H1N1, which was, a time a few years ago when we needed to do mass vaccination with a new vaccine. So we talked a little bit about that. We talked about just some of the things, some of the projections that they have. Obviously, we don't know when a new vaccine would be available, but we talked about how might we think about making that vaccine available to Minnesotans and priority groups and things like that. So it's been a really good conversation and very much a dialogue. And when I left the conversation to come on the call, we were talking about the role of pharmacists. And CDC was very impressed at the number of partners that we have who are pharmacists in our immunization program. And so that was what they were talking about, in the role that pharmacists could have in assisting with vaccination.
And I know that the guidelines have not been drawn up, but based upon other situations where public health has to make decisions, would it be correct to assume that priority for any new vaccine would go to like healthcare workers and those who are more vulnerable to COVID-19?
Yes, I mean, we talked about the role of providing vaccines to critical personnel as well as vulnerable populations, and just how would that be done, and the practical side of literally identifying individuals who may fall into certain categories. I think one of the other things that we talked about is, we've talked a little bit about, is just the logistics. The expectation is that this will be a 2-dose vaccine, and there likely will be several different formulations or manufacturers, and so it'll be important to track that an individual receives the same vaccine for their first and second doses. So lots of good conversations about those kinds of details, and obviously plenty of times where we have asked CDC a question and they've said, we're still working on that, or they've done the same to us, and we've said, yeah, we're still thinking about how that could happen. But it's been very beneficial thus far.
And just, sorry, Chris, you cut up a little bit there. The expectation will be that this will be a what vaccine? It sounded like you said pseudo vaccine.
Oh, I'm sorry, a two-dose.
Two-dose
vaccine. Yeah,
okay.
It's a real vaccine, but it will require 2 doses. And so because of that, it's very important that the first and the second dose are from the same manufacturer.
Ah, got it. Thank you.
Our next question coming from the line of Tom Hauser with KSPP TV. Your line is open.
Hi, hello, Commissioner and Director. Quick question for you about what the NFL is dealing with in terms of the false positives, including several members of the Minnesota Vikings. I'm curious if you can talk about that whole false positive, false negative issue generally, and does the Department of Health track false positives and false negatives in the public and private labs in Minnesota and keep track of when that happens so we have some idea of how much more prevalent that might be in the general population outside of the NFL?
This is Jan. I'll let Chris speak to the tracking of false results in one direction or another. Certainly, we've heard the same news. The company that produced this particular saliva test that the NFL is using released a statement that there had been contamination in their lab, and that was the source of the problem. We do get some electronic reports from the particular lab that or this test provider for COVID tests, so we'll be keeping an eye on the reports from that particular company as those come into our system. But Chris, can you say more about how we track accuracy of results?
Sure. So when results come into us, we know which lab they're from, which state, and we have obviously identifiers for the individual. So, for instance, in the case of this lab, we are able to pull up their results and then pull up the specific specimens that are tied to the Vikings. And so we're able to make, an adjustment then to make sure that we're coding those data correctly. If another laboratory that reports to us identified that they had difficulties and, had a problem with contamination or some other situation, then we would have the ability to make that same lookup and adjustment based on the information that they provided to us.
So you don't believe it's a widespread problem just generally? This is isolated more to the contamination in this one lab?
Correct. I mean, we recognize that, no test is 100% perfect, 100% sensitive, and 100% specific, meaning, that there could not be a limited number of false negatives or positives, but those are the trade-offs that we have to weigh when choosing a test. So no test is 100% perfect, but we're not aware of any issues with any other lab that would fall outside of the realm of the usual, what we call sensitivity and specificity of the test. So in this case, what this laboratory is reporting goes beyond the normal parameters of how the test performs and is based on, hey, we know that there was a problem with these tests and we had contamination, and so we're taking action. So no, we have not heard of anything like that from any other laboratory. Should that happen, we do have the ability to identify those results and make a change. But at this point, all the results that we're getting are within what we would expect for sensitivity and specificity. So what I mean by that is, there could be, yes, a false positive or a false negative within the 70,000 cases that we've had, but that is all just within the expectations of how any laboratory test would perform.
And Chris, a quick follow-up for you on the Sturgis numbers. Do you have any idea of how that compares to the positives that came out of the protests and the demonstrations resulting from the civil unrest? Because you've been focusing a lot on Sturgis in the last week or so. How does that compare to the all the people getting together during the protests and the demonstrations in terms of the number of positive cases?
You know, Tom, that is a good question. And I know if you'd asked me that in June, I could have given you the answer off the top of my head. But I will, we'll go back and look. We know that we did not, even with the targeted testing that was done, we did not see a large number of positives. But I'll just go back and check those numbers so that we can provide that so you have that as a comparison.
Okay, I'd appreciate that. Thank you.
We have a follow-up question from Catherine Richards with Minnesota Public Radio. Your line is open.
Hi. Yeah, I wanted to follow up on colleges and universities. I'm wondering if you've seen any spread of COVID-19 at any other colleges and universities as the state starts to welcome them back, you know, beyond, I think San Olaf had some cases. Have you seen any other clusters there?
Chris, you want to take that?
Sure. Yeah, no, we have not been made aware of any other clusters at this point. But obviously, I think as you've heard, you know, we have a team whose sole job has been to work with our Office of Higher Education. And so they are well connected, and we will certainly, it will let us know, you know, if we're having any activity. And then I just pulled up the data to Tom Hauser's question, looking back at the testing that we did post the civil unrest. And so we had 13,418 individuals who were tested, and we had 243 that were positive with a positivity rate of 1.8%. So obviously more cases than we have identified thus far with Sturgis, but helps to put it in perspective. Thank you.
I just want to follow up quickly on the vaccine distribution strategy sessions you've been involved in as well. Just to be clear, does this mean that Minnesota will be getting the vaccines earlier, or does that have anything to do with it at all?
No, this does not mean that we'll get the vaccine any earlier. In fact, I did clarify that the expectation was that when vaccine does become available, it will not be in a rolling fashion. That, in other words, the idea is, you know, there's 100 doses in the country, each state will get some proportion of that at the same time. But Minnesota will not get vaccine any earlier than anyone else. But this is an opportunity for us to provide input and to hear from CDC and vice versa.
Okay, thank you.
And our next question coming from the line of Paul Scott with Forum News Service. Your line is open.
Hi, thanks. I wanted to give you an opportunity to comment on the FDA's emergency use authorization for convalescent plasma. There's quite a discussion. There's two ways of looking at it. Supporters say they created a supply and infrastructure to serve small hospitals, but critics say that the efficacy is still being oversold because we don't have random controlled trial data. So what do you think about getting another EUA for a product when we don't know if it works and we might have to withdraw it like we did with hydroxychloroquine?
Well, this is Jan. I'll start and invite Chris to comment as well. And for listeners or others, convalescent plasma refers to plasma that has been donated by people who've had COVID-19. And there have been a number of research studies underway over the last several months looking at the use of convalescent plasma as a treatment for this particular disease. convalescent plasma has been used successfully in some other kinds of illnesses. So there's a theoretical basis for the hope that it would be successful here as well. And the whole process of emergency use authorization for investigational approaches and for new laboratory tests and the like is just part of the balance that Chris referred to earlier about trying to get options out there. And I'm not an expert on the FDA's process, but there still is a process to be gone through before an EUA is acquired. So it's not just an automatic rubber stamp. But in terms of the importance of the ongoing research, that is certainly the case, that the results will have to continue to be evaluated, and we're actually pleased that the Mayo Clinic is in a leadership role in this work, and certainly feel very good about the high quality of the analyses that they do. Chris, anything further?
Yeah, I'll just add, as you mentioned, certainly randomized controlled clinical trials is the gold standard for any sort of treatment. So those will need to be done. But I think, definitely we're balancing a situation in which we're dealing with a new virus, we need treatments. And so it's that balance between making sure that we're offering what look to be promising treatment modalities, as well as balancing ensuring that all of the research and safety boxes are checked. So I think it's a situation in which more research will continue, and with that, we'll have a much clearer picture of the benefits of this as a potential treatment.
Thanks. Any thoughts on the idea that as the EUA use gets bigger and bigger, the pool of patients for clinical trials gets smaller? Because people won't volunteer to be randomized to placebo if they can go and get it for sure, right?
Definitely. I mean, that's certainly a consideration. But I think, the FDA is very aware of this. They're involved in, drug licensure and this type of study day in and day out. So I'm sure that that's something that they're considering, but you make a valid point.
Thank you.
Operator, we have time for one more question.
We have a follow-up question from Tom Hauser with KSTP-TV. Your line is open.
Thanks again, Chris, for getting those numbers so quickly. That was far more quickly than I anticipated, so thank you for that. And Commissioner Malcolm, I have a question for you. Tomorrow will mark 1 month since the mask mandate went into effect. I know you've addressed this a little bit in the previous days, but I think you guys had said at the news conference announcing the mandate that in about a month's time, you'd have some idea of how the mask mandate is working. What metrics are you using to determine that? And have you seen any improvement in the COVID-19 situation since masks were mandated in Minnesota?
I'm sorry about that. I muted myself when I thought I was unmuting. I think, as we've said, it's always challenging to attribute specific impacts from a specific development when so much is happening kind of all at once. We know that the mask mandate, as you said, went into place almost a month ago. We know that social gatherings have continued to grow. Despite the presence of the mask mandate, as we've said many a time, if folks aren't also paying attention to social distancing and not circulating in the community when they have symptoms, those are all countervailing pressures, if you will. But we do think, I think we've characterized that the timing of the mask mandate and increased mask wearing does coincide with a relative stabilization of our situation. We were seeing pretty rapid rates of increased growth. And though we still are seeing, a pretty high volume of cases, it's been, relatively stable. And as we've said over and over again, to some degree, the increased cases are a result of increased testing. So we keep an eye on those metrics kind of together, side by side. How much more are we testing versus how much more are we finding? And that ratio of testing to new cases has also remained pretty stable. So I think in a lot of ways, compared to where we were concerned that we might be heading a month ago, we're seeing a more stable situation than what we thought might develop. But we're always careful to say that doesn't mean that we can let down our guard on any of the other mitigation measures as well. So
is there going to be a way to definitively say how well it worked or what kind of impact there is, given the fact that I know in the last month, I think deaths are up slightly, hospitalizations have stabilized at a higher rate? Are you more focused on the number of positive cases, or how can Minnesotans ever know specifically that the mask mandate is working?
Well, I think it's a fair question, and understandably, everybody wants to know, well, how much did it help? I think the fact that it helped is pretty clear from our own experience and from other studies that have been done. But trying to attribute a percentage impact is going to be, I think, very difficult. But the fact that the timing overlaps as clearly as it does between sort of stabilization of some of these measures with the mask mandate, we think is certainly an indication that it's been helpful. Is it, the answer all by itself? I think we've been clear since the beginning that this is a really important tool in combination with all of the other mitigation measures that we continue to need to pay attention to.
Okay, thank you.
And that's all the time we have for this afternoon. Thank you to our speakers and the reporters on the call. If you had a question that you were not able to ask on the call, feel free to reach out to our office. Thank you all for joining us, and have a good day.
This has been a WDIO News Special Report.